Pelvic floor dysfunction physical therapy is what we're going to talk about right now. Hi, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County, so stay tuned. All right, so chances are if you're watching this, you have mild to moderate case of pelvic floor dysfunction, though chances are it's just the muscles of the pelvic floor that is basically blamed for your issues at hand. I want you to understand that just the muscles of the floor are not the only culprits. So the floor, which is right above your bottom between your legs, just at the bottom of your pelvic girdle, right in that bowl, there's an outside and there's an inside. When you go and you seek care at a pelvic floor physical therapist office, they work on the muscles that are inside this bowl by going in through the anus and or vagina, and they access the inner side and they work on loosening things up and activating those muscles, which is definitely helpful. The problem, in some cases, they may actually be able to work on some of the muscle attachments of this floor in the hip regions, because that's where they're connected to. So if the bowl is like this, the legs are hanging here. So the pelvic floor dysfunction is more than just the floor, but also where that floor is impacted by, which are your hips, your lower ab, slightly above that, which is mid portion of your ab, your oblique muscles, the lower part of your lower back, and the lower part of your mid back, as well as the back portion of your pelvis, which is referred to as sacroiliac joints. Pelvic floor dysfunction is more than just the muscles, more than the ligaments that keep everything nice and together, and more than the bony alignments of your pelvis. Pelvic floor dysfunction is heavily impacted by how you move. That's a huge thing that we're missing. So when you see a physical therapist for your pelvic floor dysfunction, you're addressing a portion, not all, but a portion of treatment. But the true treatment has to involve all those areas, including the pelvic floor, kegel exercises, which thankfully in our office, we have the emsella chair, which provides 400 kegels a minute, that's more than one a second, for addressing just those muscles. We also in our office, in our clinic, we go through assessment of your functional movement, your functional fitness, which I'm gonna make sure I put a link right in the description box so we don't make this video into another video. So understand that there are more things that need to be done that are currently not being done. If you have any questions, make sure you contact me using one of the methods of contact in the description box. Subscribe to the channel and do know that you have options. Until next time, take care.